None of us wants to see someone have a heart attack, especially someone we love. But in a cardiac emergency, knowing what to do is essential for saving a life. The key is to remain calm and take the right steps. First, you'll need to know the signs of a heart attack, which is commonly due to a blockage that interrupts the blood supply to the heart, causing heart cells to die, as well as sudden cardiac arrest, which is the sudden loss of heart function caused by the failure of the heart to contract effectively. The American Heart Association says to watch for these heart attack signs: chest discomfort that lasts more than a few minutes, discomfort in the arms, back, jaw, neck, or stomach, shortness of breath, nausea or heavy sweating. According to the National Institutes of Health, a third of women may not have chest pain during a heart attack and instead experience the other symptoms or extreme fatigue. Call 911 if you or someone else has any of those symptoms, urges the American Heart Association. Time is critical, since the heart muscle begins to die as soon as the heart attack begins. And if you suspect that you are having a heart attack, do not try to drive to the hospital. Instead, call 911. Another type of cardiac emergency is sudden cardiac arrest, which requires you to take hands-on action. The two signs of sudden cardiac arrest, according to the American Heart Association, are a sudden loss of responsiveness. An example might include someone failing to respond to a tap on the shoulder, and abnormal breathing. For instance, the victim is not able to take a normal breath when you tilt the head up and check for at least 5 seconds. Sudden cardiac arrest, if left untreated, causes death within minutes. It requires you to take hands-on action. If you are in a public place with an adult who has these signs of sudden cardiac arrest, call 911. Then find an automated external defibrillator, commonly referred to as an AED. These are often located by fire alarms or other visible places in office or public buildings. Follow the instructions on the AED, placing the AED pads on the victim's bare chest as indicated. The machine will assess the heart's electrical charge and advise whether or not it should administer a shock. You will then be instructed to begin the 3 steps of CPR, which were recently rearranged by the American Heart Association to increase the life-saving potential of the procedure. Although an untrained bystander can use an AED, only someone with a proper training should administer CPR. Sign up today for CPR training in your area so that you are prepared in an emergency situation. And if you're already trained in CPR, consider a refresher course to learn the new CPR procedure recommended by the American Heart Association. Someone else's life may depend on it. Would you know what to do in an emergency? Go to baylorhealth.com/emergency care to learn warning signs for other conditions and find an emergency department at a Baylor hospital near you.